News today that could impact what kind of immunizations you can get at the doctor's office. A CDC advisory panel voting to abandon its recommendation that all Americans receive the COVID-19 vaccine. At the same time, the American Academy of Pediatrics is criticizing the panel, saying that their recommendations are putting children's safety at risk.
Today, a new CDC panel handpicked by the nation's top health official, longtime vaccine skeptic Robert F. Kennedy Jr., unanimously dropped its recommendation that all Americans get the COVID-19 shot, instead saying it is an individual choice. It's unclear what implications this could have on access and insurance. Before its vote on the COVID vaccine, the panel today postponed another vote related to the at-birth hepatitis B vaccine. Members deciding more discussion was needed to consider whether to recommend changing the vaccine schedule from a shot administered hours after a baby is born to one given when a baby is 1 month old and only if the mother tests positive for hepatitis B. Today's hearing was closely watched by top doctors who were concerned the panel is not taking the right steps to make decisions affecting millions of people. Among those concerned, President of the American College of Pediatrics, Dr. Jason Goldman.
From my observation sitting there, they did not have the information. They did not go through the rigorous scientific, transparent process, and it became very evident that they were asking questions and presenting information that had not been thoroughly vetted.
It comes one day after the new CDC panel recommended changes to the MMRV vaccine, a combination shot against measles, mumps, rubella, and chickenpox. The panel voting in favor of changing that to 2 separate shots, citing concerns about children's safety.
Several national medical organizations have accused this decision of just causing more fear and potentially pushing people in a situation where they're going to see MMRV and think, oh my gosh, it's not safe.
That confusion resonates with Juliana Gonzalez, a mother who admits she's heard competing voices about vaccines and didn't know who to trust.
A lot of the information that I was receiving was not necessarily from credible sources. Again, I was a young, impressionable mom, and I had my concerns.
Right now, there is no word on when the CDC panel plans to revisit the hepatitis B vaccine recommendations. However, any changes to the vaccine schedule would have to be approved by the CDC director.